Hello, welcome to Wellness Wednesdays. This is a special series produced by the Society for Integrative Oncology. My name is Lee Leibel. I am an active member of the Society and I'm delighted to be here today as your host. I have a mind-body practice at Columbia University Medical Center in New York City, working with cancer patients at all stages of care. So the purpose of our Wellness Wednesdays is to share with you the breadth and diversity of evidence-based or evidence-informed mind-body practices that can help us better manage stress, reduce anxiety, cultivate resilience and compassion. And these are all skills that are so important for us during, well, especially during the COVID pandemic. And they are especially important for cancer patients and survivors who, and our frontline providers who are navigating the system during this difficult time. So today our program is going to focus on adolescent young adults, and the acronym for that is AYA. And I want to acknowledge up front and also welcome, we have many people watching us from around the world. So when we talk today about AYA, that is what we call it in America. And our National Cancer Institute, NCI, defines this age group from 15 to 39. Now, this may not be applicable to what is going on in your respective countries, but please be aware that the themes are universal and the challenges that are unique to this population as they are not only navigating a cancer diagnosis, but also navigating all of these important developmental life milestones. So thank you for joining us. Today we have two unbelievable panelists. I'm so excited to have them with us today. And they're going to be talking about not only challenges, but offering up solutions with a call to action at the end, things that we can all do. And we're going to be looking through a dual lens. We have a young cancer survivor who will be looking through the survivorship lens. And we also have a clinician and a researcher who will be giving her special perspective. So with no further ado, I am so delighted to introduce, I'll begin with Dr. Perez. Dr. Giselle Perez is an assistant professor at Harvard Medical School, and she is a clinical health psychologist at Massachusetts General Hospital. Her special interest is cancer survivorship, cancer prevention, and bringing mind, body, and behavioral interventions into clinic to help support various populations, including minority groups, underserved or underrepresented groups, vulnerable populations, and especially adolescent young adults. It's my pleasure to welcome you, Dr. Perez. Thank you so much for joining us today.
Thank you. That was a lovely introduction. Thank you so much for having me.
Thank you. And I'm also just really excited to introduce my colleague, Ms. Amelia Coffaro. And I was going to call her Ms. Coffaro, but she said, please call me Amelia. So with your permission, I will call you Amelia for our informal program today. Amelia is, as I mentioned earlier, she's a young breast cancer survivor, and she'll be sharing her incredible story with us. She is also a certified yoga therapist, and she works in the Chemotherapy Infusion Center at Ascension Columbia St. Mary's Cancer Center in Milwaukee, Wisconsin. Amelia is also the manager of the Bounce Back Research Project that's actually led by Dr. Perez, and it's a study creating stress management tools for adolescent young adults. Amelia is also very, very active in the yoga special interest group for the Society for Integrative Oncology. And she's really passionate about advocacy and dedicating her life to improving the lives of adolescent young adults and using mind-body medicine really to empower people and give them self-agency. So Amelia, thank you so much for joining us today.
Thank you, Lee. Thanks to SIO for this opportunity, and as always to Giselle for participating too. This is awesome.
Thank you guys so much. Let's start out. So this is an informal roundtable, and everyone who's joined us today, you are have a seat at the table. Please communicate through chat, and we'll open up for your questions for the last 10 minutes. This will be a 30-minute program. And I'm going to start with Amelia. Can you just share your story with us? You're so inspirational.
Sure. So before I get to that, I just wanted to make one note about, I get to work with Giselle managing the stakeholder group. So the group that informs parts of the study, how we work together, how we further bring the study into the world to serve AYAs. And so I'm just one voice and one story, and I'm so grateful for this opportunity. So as Lee mentioned, I'm a 7-year survivor of inflammatory breast cancer stage 3, and I was diagnosed shortly after my 28th birthday. So I had gone symptomatically misdiagnosed for almost a full year before I officially received a diagnosis. And at the time I was living in Brooklyn, I worked all over New York. I came home to Milwaukee, where I live and where I'm from, to see my doctor. And the next day had a diagnosis. Within 5 days had a workup, a treatment plan, a port placed, and started my treatment on Valentine's Day. And so at the time, we didn't know. I had no family history of breast cancer. I was told I was too young to have breast cancer. And then about a year into my treatment, I learned that I have a TP53 mutation and something called Li-Fraumeni syndrome, which puts people at high risk of cancer across their entire lifetime. And so there were two really defining moments for me early on in my experience as a patient that really inspired me and motivated me to want to pursue a path in yoga therapy. And the first was that I saw my tumors. I saw the mammogram. They were both shaped like hearts. They were in the left breast near the heart. And as we know, in many cultures and traditions, this is really symbolic of wisdom and emotion and intuition. And so for me, seeing was really offered a lot of insight and clarity around opportunities for healing in my life, how I wanted to support myself as a patient into my recovery, how I could trust myself, especially as you're receiving so much information from healthcare providers, from friends, from family, who all have a say in the experience. So it was a turning point for me in learning how to not only use my voice as a young woman, but learn how to use my voice as a patient, that this was symbolic of learning how to develop my intuition, my inner knowing, and how yoga played such a part in it. And then the second was twofold. I was hearing stories of other young women who were experiencing misdiagnosis. It was really incredible and almost overwhelming. And I also very quickly learned that mainstream yoga studios, online offerings, they weren't meeting the needs of people with cancer and of young people with cancer. So I was really interested in integrating the experiences I was having into a way that could be of service to people going through something similar.
Thank you for sharing that, Amelia. I'm going to toss this over to Dr. Perez, and if you wouldn't mind talking a little bit about the AYA population and some of the key disparities that face this group as a population.
Absolutely. So I want to reiterate how you started the presentation is really defining that AYA group. And it's important to define them because of the fact that there are certain factors that make them sort of more of a combined cohort, and why we have them stand out in comparison to those who are diagnosed as a child or as an older adult. So at least within the US, as defined by the NCI, it is those who are diagnosed with cancer between the ages of 15 and 39. It's different from how the term is commonly used. And I think when you're looking at the literature, you're going to see so many variations and outcomes because people blend different groups into this population. So sometimes if you have a child who's diagnosed with cancer but grows into become a 15, 16, 17-year-old, sometimes they're grouped under AYA. That's actually inaccurate. So when you're thinking of this group, it's specifically the timing of diagnosis. The other piece also that's important here is the reason why we're highlighting this population is because, and this is where the disparities comes in, we're not seeing the same improvements in terms of survival rates as we're seeing amongst those who are diagnosed with cancer as a child or as an older adult. So this is sort of what triggered an emphasis on looking at why is this happening? Why are we seeing this population diagnosed with cancer during this tender period not seeing the same improvements in terms of their cancer outcomes, in terms of their survival, in terms of distress? So what we are seeing, some of that has to do with the profiles of their cancer. So their cancers behave differently. Treatments have not made the same progress. Essentially, what we're seeing is that there's less progress in treatment, less participation in cancer clinical trials. AYAs are not often referred to cancer clinical trials as well. So we're just not seeing the same level of progress. Side effect profiles are also very different. So in terms of even the risk factors for sort of what happens after cancer treatment looks differently. So if you're thinking about this population that's diagnosed with cancer during this tender period of development, you can see especially how other factors may impact sort of their adjustment to cancer, their health behaviors, all the factors that can also contribute sort of how they respond to cancer treatment and beyond. So in terms of the disparities, there's this issue of survival. We also see higher rates of distress, really high rates. Again, if you're looking at a lot of the surveys or work that has been done, this group tends to be at higher risk for more clinical levels of distress than others. But again, if you think about that timing, and Amelia will be speaking more about this, you're diagnosed with cancer during a time of significant emotional and physical development. So what you're seeing is a population that's negotiating the challenges of normative development with a cancer diagnosis that essentially conflicts with all those challenges. And there are no treatments really out there because, again, this population is a missed population. When we're thinking of AYAs, we're thinking of resilient individuals, which they are. But again, an AYA with cancer without, you're struggling with the typical challenges of what we're experiencing in society. So we're just not screening appropriately, and we're not providing care, and especially we're not providing tailored services. So I want to stop there because I want to have Amelia speak to that as well.
Jump in, Amelia. Quality of life and also mental health resources that are not available that you identified.
I can quickly just go over some of the more specific quality of life issues, if that's helpful, so people can make that connection. So some of the literature shows reduction in or absence of empowerment, developing their sense of autonomy, identity, pre and post cancer. So Giselle, you've talked about too, like the integration of who are we after cancer, finances, disruption, education, employment, careers, and relationships. So not only social isolation, but an understanding from our peers who haven't gone through cancer can be really challenging. Fertility issues, body image, sexuality, and as Giselle said, higher symptom burden, depression, anxiety. And as a result of all this, on top of that, we have one of the biggest unmet needs is mental health resources. So I want to throw it back to Giselle and ask maybe if you want to touch on where we see the greatest disparities in mental health resources for this population.
That's a great question. I think just in general, having access and acknowledging that their perspectives might differ, not only from the provider who's providing treatment, but also from the typical individual who is diagnosed with cancer. Because again, even though we know that this is an issue with our AYA population, they are considered to be a rare population. As you had said, it's not usual, it's not common to see a young person coming into one's clinic who's struggling with cancer. So it's this issue of acknowledging that, we don't have to look for distress per se. We don't have to look for clinical levels of distress. We can just assume that the challenges an AYA is going to experience is going to be, different from their older peers. So things like accessing insurance, paying for their own medical care, having this issue of fertility, right? about 1 out of every 2 AYAs don't even recall having a conversation with their provider about their fertility risks. And then what happens then? What happens when maybe there's a loss of fertility, and being able to talk about and process that loss, because they are now met with peers who can't quite understand, especially if you're an AYA who's in their 20s and their peers are not even thinking about children. But it's this idea that that option is no longer provided to you. You're sort of robbed of something that is a normative milestone. So I think in terms of just thinking about specifically disparities in relation to mental health, there's a lack of targeted treatment. There's a lack of understanding that there are things that maybe this population is needing to cope with that may not rise to the level of clinical distress, but is a normative level of distress that may just require some connection with provider to address.
And if I could add to, I think just going through the experience of, okay, what is to walk into an oncology center and meet all these people. There are still some hospitals that don't have mental health resources on site in the oncology center. So there's that. Then it's up to the patient, it's up to us to navigate that. So sometimes the resources from the provider are minimal, and maybe they don't mesh well with the patient's needs. So on top of having to go through the treatments and deal with the side effects, then you're trying to find somebody to mesh well with you, which can take some time. It's not always an instant connection. So I think, there's a big opportunity there for us to look at this issue and how we address that. And the last little thing I want to just add to that was sometimes the care team into survivorship has the expectation that you look better, and so everything's great. Life is back to normal. And I hear from a lot of my peers and friends that there are challenges here, and sometimes like a certain amount of pressure to look good, to feel good when you go in for follow-up. And the reality is sometimes that's not what's happening. So really needing to develop a better understanding from the providers about what is really going on for patients.
And that's exactly, I think, the biggest gap here, because it goes back to this issue of tailoring, right? It's the provider not necessarily asking the questions, but not knowing what to look for, and sort of expecting that referrals happen when there's a clinical need, as opposed to understanding that we can think of this as sort of preventative. If you have this expectation that these are struggles that anybody within this age group is going to face, then understanding that there's a need to provide them with resources and skills to manage those changes in their life. And then with respect to, as Amelia, as you were saying, with the resources, I mean, it really comes down to, even with hospitals that have resources, the ability to address these challenges, the ability to meet the AYAs where they are. That does require a level of specialized training that we just are not providing. So I think when we're thinking about why there's a need for AYA programs, for instance, is because that allows you to have that specialized training that will enable you to know what are the things that what are the questions that you need to ask, and how can you, as a provider, empower your AYA to feel like they can, that they have the ability to return to a life that they at least anticipated, or how can they resume living in a way that they want to? How can they make the most of their life given maybe the changes that they're encountering?
Amelia, how did you navigate this on your own? Did you find national resources that helped you, different support groups like Elephant and Tea, or and how did you get into the yoga and the mind-body therapies to support your emotional and physical well-being?
So I had a yoga practice before I got sick for about 10 years, but when you're in your 20s, it's hot yoga, go for the burn yoga. And that was very much how I used yoga. When I got diagnosed and I went through a period of not even being able to get out of bed for a couple of months, I quickly learned that yoga was about breathing. And I learned that from some teachers that I had found back at home, but I also had a really wonderful mental health therapist who integrates a more based approach to therapy. And so she helped point me in some directions for resources. But the training that I took, I love sharing this story. My surgeon's mother was a yoga teacher. And I knew that, you know, I'd gone to some studios at home. I quickly learned that, again, they couldn't meet. And so I had approached my medical team and I said, if I do my training, could we come together and create something for survivors? And it was my surgeon who said, well, my mother knows this woman. Her name is Yanni Chapman. She's a nurse and she lives in San Francisco and she's developed this training. Don't reinvent the wheel, go do her training. And that completely changed my life. And having the experience of training alongside somebody who worked with patients for her entire life was so unique and such a special opportunity. So that was my first getting my feet wet into yoga therapy and learning that and learning about how to want to integrate that for people.
That's great.
Yeah.
I want you to continue talking a little bit about the mind-body therapies that are useful in this age group, but I also want to invite the audience to start putting some questions into chat, and I'll read them out. But while we're waiting for some questions, why don't you just continue with sort of that mind-body aspect of managing stress and promoting resilience. And I'll throw it to either one of you.
Giselle, I think if you want to start and kind of give us a big overview, and then I can go into yoga therapy specifically.
Yes. So when I think about mind body practices, or when people think about mind body practices in general, they think of one specific type of practice. So either I meditate or I do, fill in the blank. And what I encourage my AYAs to think about is actually anything that allows you to shut off the mental chatter, sort of the worry thoughts, the things that keep you going in circles. That can be considered a mind body practice, because essentially what I often teach people to do is to pick something that serves as your mental anchor, right? So if you think of thoughts being sort of like a boat on water, right? Your thoughts will continue to sort of move away with the current, but the anchor brings the boat back. And so if you can find something that is strong enough to serve as a mental anchor for you, what that does is it allows your thoughts to wander as they would, but then it brings it back to that mental anchor. And that cycle of going back and forth enables you to deactivate your stress response. So that's how I think about the mind-body practices and what they're essentially trying to do. Your alarm system is going off. When you're thinking about cancer treatment, or how your life has changed, your alarm system goes off, right? But when that alarm system goes off, what that looks like is indigestion, headache, heart racing, a lot of other symptoms that resemble cancer and the side effects of cancer, which then trigger worries about recurrence and whatnot. So essentially, you're chronically in an activated stress state. And it's as if you're fighting something super dangerous, like I often say, like a bear or a lion, right? But when you're practicing something like these mind-body practices that Amelia will tell you a bit about, what you're doing is essentially silencing the body's alarm system. And that does a number of things. It brings you back to center. It leaves you with a feeling of control. And it also changes how your brain processes information, so that you're no longer processing with the emotional mind, but you're processing more with the rational mind. So you're thinking more logically, you're able to understand and decide how you want to respond to any given situation.
And from a yoga therapy perspective, so I'm really grateful to two of my primary teachers I mentioned, Yanni Chapman and Dr. Timothy McCall, who have really taught me that healing physically, mentally, emotionally happens when we learn how to meet people exactly where they are. And so this supports what Giselle was saying earlier about this population. So whether it's a specific meditation, yoga postures, it's never a one-size-fits-all approach. And so I think from a yoga therapy lens in supporting AYAs in meeting their unique quality of life challenges across the continuum, we have to find ways, I think, to further integrate the yoga therapist with the oncology care team. I think there's a big opportunity there so that the yoga therapist can address the needs on an individual basis. And I think continue to address those needs as they change across the continuum, because it's always changing. And that's really the beauty of yoga therapy, is you adapt as you go along. So AYAs then know that they have the tools, they have the resources to support their mental health at any point that they need. The second thing I think is that yoga therapy supports mental health by encouraging and developing consistent and sustainable lifestyle habits that help us build resilience. I think a really big part of this is also, I'm sorry, I'm just like hearing feedback, I can't. Okay. I think a big part of this is educating young people on how a yoga therapy framework can potentially help us shift this paradigm. And I think that we see a lot in mainstream wellness, which is go for the burn and go, 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 go. And messages of good vibes only, to one that really embraces a therapeutic approach to yoga therapy, to integrative medicine. So empowering AYAs that like, it's okay to feel sad and bad sometimes. That's normal, that's part of healing. But you can also then choose to use these tools to care for yourself, to create your own calm. So they have a choice. I wanted to just touch on one thing, which is that, you know, increasingly we're seeing, I think, more research and resources being put towards mind-body medicine for AYAs. It's still needed, it's still growing. Something I'm very, very interested in is the work of self-compassion and mindful self-compassion. So this is Dr. Kristen Neff's work. There was a study done from University of North Carolina at Chapel Hill that adapted her mindful self-compassion with AYA survivors, looking at how it could support psychosocial needs related to experiences as survivors, specifically around like peer isolation, body concerns, health-related anxiety. And so some of those early findings did indeed show that the more that a person could cultivate a sense of warmth and kindness towards themselves, the better outcomes they had in dealing with some of these issues. So that area is really of interest to me. And I think that further supports how you meet your own needs, because we all go through different things. And that self-compassion piece is really soothing what's present and true for you. Loli, you're muted.
Sorry, I muted to stop the noise. Thank you, Amelia, for that, is what I was saying. We have a few minutes left. This time just flies by. There are a couple of questions. I just want to throw them out. If you can just give like a couple sentences, because I want to get to everybody. First is, are there differences between men and women, male, female, in the population in terms of special challenges?
There are some differences depending on sort of, I mean, across age of diagnosis and also kind of specific needs. So for instance, you might have women who are particularly challenging with fertility concerns. You might see higher distress associated with that. So that would be one example of a challenge. Whereas with males, for instance, there might be more body image concerns as well, especially for some treatments that might limit the body composition. So there are some differences, but a lot of the similar themes across the board with respect to their attainment of developmental milestones. That's where you see the similarities.
Great, and I have a follow-up to that, Dr. Perez. So one of our attendees has asked, during this time, generally, adolescents and young adults are pulling away from their parents to develop more independence. And now this is a time where they really need to come back for the family support. Can you just comment on that?
Yes, that's a long piece. Yes, there is a lot of support that's needed, and they value that support from their families. But remember, this aspect is in conflict with what they want to do. So there's a sort of
difficulty, especially with respect to their medical treatment. Like, providers do need to acknowledge that there's a sense of needing to have the family on there, but at the same time support AYA's desire to become more individualized. So that's something that's hard to navigate during this period of time, because there's sort of the family that also wants to sort of be there and support the AYA, but at the same time, the AYA needs to return to feeling confident in their ability to sort of grow and become more of an individual. So that conflict exists, and that's something that does need to be addressed clinically and also when working with a provider.
Great, thank you. And just sort of closing comments, always love to leave the audience with a call for action and really next steps, things that they can do either in their own clinic or in their own families if they are either AYA survivors themselves or family members. Dr. Perez, do you have just a few sentences around that? What can we do?
Words are powerful. So if you're a provider, just ask. Many AYAs want to know that they want to be heard, that they can talk about these things and that it's safe. So as a provider, ask. As a family member, give room. As a provider, understand power dynamics as well, and ask, do you want your family involved, especially with certain sensitive topics? As an AYA, it's important to know that you matter and that things are going to be different. And as Amelia said, don't feel alone, because there are so many other people out there who are experiencing the same thing. So I want to leave it there because Amelia has a lot of wonderful things to contribute as well. So I'll stop.
Okay, thank you. Amelia, jump in. You've got a minute.
Okay, I have 3 calls to action for us today. So on a small scale, I think learning how to be kinder to ourselves, we could all benefit from that. As patients, as practitioners, providers, the more we know ourselves, the more we can come to know the people we work with. At a larger scale, looking at how things like self-compassion, integrative medicine are integrated into oncology care from the top down. So just speaking from a patient perspective, it's a very fast-paced environment sometimes, and seeing how hard the care team works to take care of you, and also recognizing that they have self-care needs too. So I really think that the more we can do that, the better the co-creation of the care for the patient will be, especially with relationship to outcomes and quality of life. The second, which is something I'm really passionate about right now, there's a really big movement in the yoga community to advance training of teachers to learn more about issues like trauma, race, gender identity, and how yoga can support those needs. At the same time, as more and more young people become sick, this is the reality. And so how can we merge the two? So I think there's enormous possibility for integrating yoga, diversity, inclusion, equity together to be of service to AYAs. And then my last call to action for us is, if you're interested to join Giselle and myself and 2 other colleagues on October 17th at 11:50 a.m., we're going to present and go a little bit more in depth on these topics for the SIO virtual conference. So we'd love to see you, and thank you everybody so much for being here.
Oh gosh, and so if you want more information on the annual conference for the Society for Integrative Oncology, which is virtual this year, so everyone can attend, go to the website, which is integrativeonc.org. And Dr. Perez and Giselle will be leading a workshop, and we'll take a deeper dive. We'll have more time. And thank you, Amelia, for the point about diversity and inclusion in the yoga community. And that's a beautiful point. And we're really, there's quite a movement moving in that direction.
Investing in them.
Yeah, yeah. I want to thank Dr. Perez so much for your time, for joining us, and Amelia also for spending time and sharing your story. And this is just kind of a sort of a quick overview for the audience to sort of put it into perspective. And please take a deeper dive and continue the conversation in your clinics on how to shine the light of awareness on this underrepresented group of cancer patients and survivors. So thank you all for attending, and I wish you a very wonderful rest of the day. Thank you.
Thank you.
Thank you. Thank you to SIO. Thank you to all. Take care.
Bye.
Bye.